Hi, once again welcome back to Obstetrics and Gynecology videos. Today we are going to see about consanguineous marriage, the trends in consanguineous marriage and its effect on reproductive health. Consanguineous means related by blood. The definition of consanguineous marriage is unions contracted between persons biologically related as second cousins or closer are characterized as consanguineous, having one or more ancestors in common, no more remote than a great grandparent. In that case, we can consider it as a consanguineous marriage. And next we can see the population types which are supporting the consanguineous marriage. Major populations in the Middle East, North Africa, South Asia, that is in these populations 20 to 50% of marriages are consanguineous. And the major populations of Latin America, Japan and in China, in that 1 to 10% of marriages are consanguineous. And recent migrants from Pakistan, India, Middle East, North Africa, South Asia, and becoming residents, once if they become residents in Europe, US and Canada, in that population also there is a tendency of consanguineous marriage. Small population isolates where inbreeding in common account for a very small percentage of the world population. Example, Amish. In that categories also it is common if the population is very small. And reasons for this cousin marriage or consanguineous marriage is sometimes it may be a cultural trend in that society. And another reason, these people are believing that the wives will be having a better relationship with the in-laws and they will be more safe and they will be more protected and their needs will be met effectively when comparing with the stranger family. And another reason, they are believing that they can avoid the uncertainty of marrying a strange person, and sometimes that person may be having a hidden health or financial uncertainty, so that uncertainty can be avoided. And premarital negotiations like financial matters related to the money, property with the family, all those things can be avoided, and whatever they are having in their family, their financial property will be with them only, no need to give to another family members. So this thought is also giving rise to this consanguineous marriage. And another reason, it strengthens the family ties and enforces the family solidarity. Because of this reason also, some people are encouraging this consanguineous marriage. And the factors affecting consanguinity rates include, it is higher in rural areas when comparing with the urban community, and it is low in the areas where the females are having more education. First cousin marriages are more common when the parents of the couple are consanguineous, and in the same community also sometimes it is higher, the rate is higher in certain religions. For example, it is higher in Muslims when comparing with the Christians. And the factors that may decrease the consanguineous marriage include higher female education. If the females are having better education, they may not agree for this. And higher age at marriage. If the age of marriage is increasing, naturally consanguineous marriage is also decreasing. And lower fertility. If the fertility rate is less, in that case also the consanguinity incidence is decreasing. And more mobility from rural to urban area. If a particular from a particular area, if more people are moving from the rural area to the urban area, in that cases also the incidents have been observed that it is less. And those who are having better economic status, in that cases also these consanguineous marriages are less. So from this we can conclude that the people those who are educated females, if they are having education, if they are having proper economic support, and if they are living in urban areas, the chance for this consanguineous marriages also will be less. Next we can see the effect of this consanguineous marriage and reproductive health. This, if you are taking the number of abortions, it is almost comparable in the consanguineous and in the non-consanguineous couples. And if you are taking the data from the data of stillborn rates, it is either similar or slightly higher among the consanguineous couples than the non-related couples. It is maybe similar or slightly higher stillbirth rates. And there is a positive association between the parental consanguinity and the childhood and infant mortality. And the complaint data, the study among the 38 different populations, that is around 6 lakhs of pregnancies, shows that there is 4.4% increased pre-reproductive mortality above background risk for offspring from the first cousin unions. That is, the mortality rate is high, infant and childhood mortality rate is high in the consanguineous marriage. This study shows that. And most studies shown similar or higher fertility rates among the consanguineous versus non-consanguineous. And in majority of the cases in the consanguineous marriages, the fertility rate is high. The reasons are, in majority of the cases, the females will be having young age, so the reproductive span will be more. And another reason, lower prenatal losses among the consanguineous couples. This is also a reason. And if you are looking into the consanguineous marriage and congenital malformations, the chance for getting congenital malformations is 2 times higher in the case of consanguineous marriage. It is 2 times higher when compared with the general population. And consanguinity and specific congenital malformations. The studies have shown that there is a positive association between consanguinity and congenital heart defects. So the chance for getting congenital heart defect is also more. And actually the study which is conducted on the incidence of cleft palate and neural tube defects and consanguinity, it is not clear. Actually, we are supposed to conduct more studies in this aspect, but congenital heart rate or congenital heart defects are more in the consanguineous married couple. It is very clear. It is proven by the studies. So if you are taking a summary of the health parameters, earlier prenatal age of marriage can be seen in the consanguineous marriage couples, and younger maternal age at the first live birth is seen because usually the age of marriage will be less in the case of consanguineous couples, and the higher number of infant born in consanguineous parents, the fertility rate is also high. Lower rates of primary sterility, so infertility rate is also less in the case of consanguineous marriage couple, and the abortion rate is almost same or lower, but higher concentration of postnatal mortality in the offspring is there, and higher concentration of congenital malformation is also there. So these two things are the defects of this consanguineous marriage, and there is a chance for higher risk of offspring with the autosomal recessive disorders if present in the family. If family is having such a history, the risk will be more in the case of consanguineous marriage, risk for getting autosomal recessive disorders. And if you are looking into the consanguinity and genetic disorders, there is no association between the consanguinity with the autosomal dominant X-linked and the chromosomal disorders such as Down syndrome. But already we have seen there is a relation between the autosomal recessive defects and the consanguinity. That is, the chance for getting autosomal recessive disorders is more in the case of consanguineous marriage. Among the genetic disorders, only autosomal recessive disorders are strongly associated with the consanguinity. Approximately 30% of the sporadic undiagnosed cases of mental retardation, congenital abnormalities, and dimorphism may have an autosomal recessive etiology with the risk of recurrence in future pregnancies. So these autosomal recessive disorders are more common in the case of consanguineous marriage, and the chance for getting this disorder is also more in the case of consanguineous marriage. Consanguinity increases the risk of expression of autosomal recessive conditions in the offspring. This effect is more pronounced for rare disorders. And consanguinity and chronic adult non-communicable diseases. Actually, there is no evidence that the consanguinity is increasing the non-communicable diseases such as hypertension, diabetes, all those things. But both parents will be having the history, so the chance for occurrence is more, but still we are supposed to conduct more studies on that. And now we can see the consanguinity and the genetic counseling. There is genetic diseases in the family and the couple are consanguineous. In that case, surely we are supposed to give the genetic counseling. And if there is a non-genetic disease in the family and if the couple are consanguineous, in that case also we are supposed to give the genetic counseling. And for giving the genetic counseling, we have to take a detailed history, and the history should include the non-genetic diseases, history of congenital malformations or birth defects, childhood hearing and vision impairment, mental retardation of the children, unexplained neonatal or infant deaths, failure to thrive, inherited blood disorders. If these histories are there in the family, and if the couples are consanguineous married couples, in that case surely we have to give the genetic counseling for these couples. If there is a non-inherited disorder in the family, then the first cousin marriages are sometimes give risk for birth defects of about twice the risk of in the general population. That is, example 4% instead of 2%. So in that case, we should give compulsorily. We should give the genetic counseling for this couple. Counseling the families with a non-autosomal recessive disorder also should be done, and in that case, we should establish clinical and molecular diagnosis whenever possible. Premarital and pre-conception career testing for the consanguineous couple should be done, and if carriers cannot be diagnosed, give risk estimate. Counseling to minimize the further consanguinity unless the carriers can be diagnosed. That is, in that family, if there is a history of autosomal recessive disorder, we should discourage the consanguineous marriages. And counseling the couples with affected children by giving reproductive options such as prenatal diagnosis is if feasible. And in case if such marriages are there, means we should do the prenatal diagnosis. All the investigations we should perform for diagnosing the chromosomal abnormalities, and if such things are there, means we should advise the couples to terminate the pregnancy. So these are the main things about the consanguineous marriages and its risk related to the reproductive health. Thank you for watching this video. See you soon with a new video. Bye.